Anyway, these are incredibly strange times. I'm going to do my best to try to give you some insight as to how our state has been working to combat the pandemic, and then we're going to hear from my friends Rob Fisher, of course, who I grew up with, is a very close friend of mine, and he's now working for the Councilmember, and so it's fun to be on this with him. I also just want to say that I'm acutely aware of how many of you in the business community are in such a tough spot right now. You're not only dealing with the epidemiological and medical consequences of this crisis, but also, of course, the economic well-being, both of your businesses and also those who work for you. It's been a very difficult experience. I've got some very close friends who are, especially folks in the hospitality industry, but also people who work in some of the collateral damage. Folks who work with people who are in the hospitality industry who have been really damaged. Our district is such a vibrant, exciting place that people want to come to from all over the world. We've got hospitality, we've got tourism. Ours is an economy that really does benefit from the fact that we are such an exciting place for people to come to and congregate. And I think as a result, our area has been hit the hardest, perhaps, by this crisis. I certainly hope that my presentation can give you some sense of how we can move forward. I'm also eager to hear your suggestions for how we can work better for you. I've got some staff who are here on the call right now, and I do want to just reiterate that our office doors, our virtual doors, are wide open for phone calls, emails, to address how, to help people. So just to give you a quick overview, this is stuff that most of you know, but I think it's good to repeat. Governor Newsom, of course, enacted his very first state of emergency back on March 4th. This was very early, and I think it's part of why we've been able to address the medical problems and have a much better set of outcomes than we've seen in places like New York, Louisiana, Illinois, etc. It was then soon followed by a state stay-at-home order on March 19th. Now, since those declarations, Governor Newsom has implemented a number of directives aimed at flattening the curve of COVID-19 and lessening its impact. Some of the examples include everything from, offering folks a 90-day extension to file their California tax returns, negotiating mortgage relief for homeowners, landlords, et cetera, ramping up our healthcare infrastructure to handle a potential surge in patients. Before we went on to recess in mid-March, the legislature appropriated over $1 billion to respond directly to the most immediate needs of the state. We created an emergency fund that's been used to purchase healthcare equipment, open new hospitals, provide cash to help schools stay afloat. And this was a very, kind of a unique situation where the legislature really did hand a lot of power over to the governor. There's a very interesting piece in today's LA Times on the front page of the California section that talks about some of the tensions that have arisen. I think folks initially were very supportive of Gavin Newsom's response. And I think for the most part, people are very appreciative, but there have been a couple little moments, points of tension. In the state legislature, we've really restructured the legislative committee apparatus to focus almost exclusively on COVID-specific responses, though, of course, other crises continue to be out there. Wildfires, our homelessness and housing challenges that have interspersed and interwoven with our economic challenges right now. The legislature, the Senate, has been producing these policy pods. It's a weekly document that's now over 150 pages long that detail information that our offices can use to advise constituents and stakeholders who call us with just every issue under the sun. You'd be amazed by the kind, and I know Rob and our folks from the other Supervisor Kuehl's office will know as well. But we get calls on every issue under the sun: schools issues, safety of drinking water, utility shutoffs, mortgages, property taxes, cannabis laws, alcohol issues. I mean, the list goes on and on and on. And our offices are in very frequent communication with the governor's office. We pass along information and offers to help from all sorts of different entities who are otherwise unable to be in contact with the executive branch directly. As of today, there are nearly 50,000 known cases of coronavirus, nearly 2,000 fatalities from coronavirus in California. And as I mentioned before, we certainly mourn those lost lives, but our early action has really put us in a much stronger place than states like New York in Louisiana. And I know that, you know, folks have heard this, but we now have more deaths, at least reported deaths associated with coronavirus than any other country on earth. You know, there are open questions about how open and honest some other countries like Iran and China have been in terms of their COVID-related deaths. But this means now we have more people have died, and due to COVID, more Americans have died due to COVID than died in the Vietnam War. And of course, if you think about that, that's really extraordinary because these deaths have happened just in the last 2 months, whereas the Vietnam War stretched over nearly a decade. So the fact that we've had a relatively minimal impact in California, and I don't mean to discount the difficulties and the deaths and the loss, and there may be even people on this call who have lost somebody to COVID here in California, but we have really made a big difference compared to other states because we acted quickly. But I will say that collective action has exacted some very serious pain, and I don't have to explain that to the people on the call who are in the business community. Now, the state has been working closely with the federal government to try to help. I know many of you have been recipients. I know this because we've been working with some of you. You know, the bulk of the cash stimulus for small business has come out of the federal government, of course, but California has responded in its own way to relieve some of the pressures that you're facing and act as a counter to some of the frustrations with the SBA and PPP loans. California actually established its own small program to offer $50 million in microloan guarantees for small businesses that may not be eligible for federal relief. Governor Newsom also authorized small businesses to defer payments of sales and use taxes of up to $50,000 for as long as 12 months. And he also provided a 90-day extension of tax returns and payments for all businesses that owe less than $1 million. And lastly, and this is important, the administration extended the deadline to file a claim for tax refunds by 60 days. So that will give people more help. You know, there's also other little things that the government has done, like, you know, the Department of Consumer Affairs waived the continuing education requirements for a number of the licensed professions for the next 60 days, though, you know, maybe you have more time to take your continuing education. Department of Labor has suspended the requirements under the WARN Act. They understood that there are a lot of businesses that you needed to shutter very quickly, and so they couldn't provide the usual 60-day notice to their workers. And so the government provided some flexibility under that. The governor also negotiated a deal with the vast majority of our banks and lenders to allow for a 90-day postponement of mortgage payments that I think has been very important. Only Bank of America said they only offer 30 days of postponement of the mortgage payments. We're going to hopefully, you know, shame them into joining the rest of the banking community, including all of their major rivals, to go up to 90 days. You know, to provide a little bit more relief to our landlords and our homeowners. And then finally, the state's offering small business technical assistance support centers to help businesses figure out which loans are best for them and develop resiliency strategies and find other resources. And we can put the number up for that. That's acting as a one-stop shop for businesses that are trying to struggle to figure out where they fit into the myriad of acronyms and loans that are out there, both at the federal, state, and local levels. Let's talk quickly about reopening and what the future is of our economy. I think we are starting to see the light at the end of the tunnel. But you know, at the end of the day, we're really focused on safely reopening the economy, getting Californians back to work, getting businesses reopened, while at the same time not negating the benefits associated with all of the sacrifice that has happened over the last month and a half, 2 months. You know, one of the things that we learned from the 1918 flu pandemic is that it was actually those communities that had done the best in shutting down their economies and addressing the pandemic back then, that then quickly reopened too fast and had much more damage as a result of a too rapid reopening. And so we want to learn the epidemiological lessons from that experience and make sure that we don't negate the impact of the benefits that we've seen so far, at least epidemiologically. Now, we don't have a crystal ball. We're working, of course, without a complete set of information to make these important decisions. But we are, doing the best that we can with the data that we do have, and identifying ways to adapt as we learn more about how the virus behaves. As folks know, Governor Newsom convened this major task force on economic recovery that includes heavy hitters such as the CEO of Walt Disney and the former Fed Reserve Chair Janet Yellen, Patagonia CEO, Apple CEO, Homeboy Industries founder Father Boyle, who I love, the owner of the LA Times, Patrick Soon-Shiong, the Gap CEO, the LA Clippers president is on there, LinkedIn CEO, but there's also, our own homegrown Rick Caruso, governors, Schwarzenegger, Pete Wilson, Gray Davis, et cetera. And this is a task force that also involves some chamber people. It's going to help, guide the governor on getting Californians back to work in the safest way possible. And Governor Newsom announced this 4-phase plan just earlier this week to begin reopening the economy. And as he puts it, it's not about flipping a switch where all of a sudden we're going to go back to normal. It's about more like a dimmer, which you up a little bit over time as the medical and epidemiological landscape can handle an increase in economic activity. So it'll get brighter over time as we gain further control over the disease. So right now we're in what's called phase 1. This is the most restrictive phase. It focuses on maintaining capacity for our hospitals, our first responders. And the idea is that once we can guarantee that we have sufficient surge capacity, and when we can sufficiently protect our frontline workers, then we move into phase 2, where restrictions are lifted for certain workplaces and public spaces. And that's going to look like retail stores, manufacturing, offices where social distancing can be maintained. Those types of businesses, those sectors will be allowed to reopen in that phase. Then phase 3, you're starting to look at things that are a little bit more social concentration heavy. So hair salons, gyms, theaters, other higher risk workplaces. And when we say high risk, it's really all about concentrating people in small spaces. So those then under phase 3 will be allowed to reopen, but with a limit on the number of people that would be in one place at one time. And then finally, phase 4 would be a full return to normalcy. What's phase 4? It's concerts, it's live sport. Sports with people in the audience. And we may actually start to see. I'm wearing my Dodger hat to remind me of how much I love live sports. I think we're going to see. And also because of the hair salons being closed, right? We're all using hats. The rest of you looking great, but I'm struggling here. I do think we're going to. What's interesting here is, and Dr. Ferrer, who's a fantastic person, and if we can, we should get someone from her department to do a little seminar with the people from the Miracle Mile Chamber, because she's been actually starting a process of focus groups with different sectors of the economy. So maybe she'll do one with retail, with banks, with houses of worship, with restaurants, where they'll do a town hall almost like this, but with maybe a smaller group of people from the sector and an epidemiologist or two and a virologist who will talk through almost like a brainstorming session, where they'll talk about how we can get most bang for a buck for that sector of the economy in a way that will not contribute to a surge in the virus. So, what does that look like for a restaurant? Maybe you just have less people in the restaurant. You use electronic ordering or by paper as opposed to close contact with a waiter. Maybe staggered hours, maybe cashless transactions, those kinds of things. I think for office buildings, it may be once again staggered hours where half of the workforce or a portion of the workforce is coming in Mondays and Wednesdays and the other portion is coming in Tuesdays and Thursdays. Maybe more infrastructure put in place with hand sanitizer and hand washing opportunities, time offered for employees to be able to go wash, those kinds of things. Obviously, conditions and accommodations made for older folks or folks who might be high risk, and also for people who might feel sick. So it's all going to be about thinking about how your business works and figuring out a way to allow your business to go back online and get you back up to speed, working, making money, all the rest, but in a way that will not significantly contribute to the chances of you being a vector in the resurgence. So,
Senator Allen?
Yeah.
Just because I want to make sure we can get to our other speakers. And what I so appreciate about what you were just saying is you gave us a great synopsis of what's been done and where we are now and what we have to look forward to. I want to take a few questions, if there are any right now, from people for the senator about state level responses and what the senator's office might be able to do to help you and your business. Are there any hands raised currently, Chris?
I'll stick around till the end of the session if people have more questions that are raised by the other presentations.
Right. How can people access those microphones?
Physically, I'll pick it up. I'm scanning right now.
All right. And so just to get us started off, Senator Allen, how can we access those state-sponsored microloans?
So we'll put up the website. It's all the information. There's a website. We'll put up the information, and people can take a look at it. And if you feel like you're eligible, and obviously apply online if you're having trouble. Most of it will be through banks, but our office has been assisting folks who've been having challenges navigating the loans. But we'll put up I know Allison is on the call right now, and she's been posting information, and we'll put up the link there for folks to access.
Great. I'll just say a little technical note while we're at it. On the bottom of your chat window, if things have been posted, there's a little thing that says file, and you can save this chat with all the information in it. So just to let you know, it's a much more convenient thing if you're having trouble following along and writing things down quickly.
Excellent.
I do have a question.
Yeah.
Alan, is anything, God forbid we go, further on into this, like past May with the stay at home, and but has anything been talked about with the banks? I know they got a large amount from the federal government as a stopgap. Has anything been talked about them either suspending or reducing mortgages payments for landlords as well?
Yeah.
It's a tough question.
Yeah, it's a tough question. So there are conversations about this. One of the conversations that people have been having has been, well, what if we were to figure out a system where you basically take the payments that were due during the crisis and you just extend the life of the loan on the back end. So, if you're 20, if you're 10, it's a 30-year loan, let's say, and you're 10 years into your loan, you just basically kick out the life of the loan for an additional half a year, whatever it will be. So, the bank still is going to get paid, and and they'll get the interest off of that as well. But at the very least, people will be given some more time, really more time. That's a lot more time. I think the fear is, right, like it's all well and good to give people this forbearance right now, but the fact is, if people don't have the wherewithal to get back on their feet over the next couple of months, they're not going to have the money 3 months from now to pay their these big chunks of mortgages. So now I know the banking sector knows this. I mean, the last thing they're going to want to see is mass foreclosure or mass default. So the question is going to become, how much are the banks going to be willing to sort of take on actions like this that I actually think will be very much, it's a win-win from my perspective, because they still get paid. They have the surety of the payment. They actually get the added benefit of extended interest payments. And it becomes a bit of a win-win. Some banks, I think, are going to be better about this than others. The question is, how much is government going to step in and mandate this? And that's going to be, that's a very interesting conversation that's happening, largely at the federal level right now.
Right.
I don't know if there are folks in the banking sector. I would certainly encourage people in the banking sector to be open to these kinds of changes, because I think if they show a willingness to shift in this direction, it will be easier to push a reform like that through through the SEC, through the Congress.
Senator Allen, we're looking forward to seeing what your office is going to do to help make that happen.
Yeah, I'm all on board.
We're going to move on to our next speaker. From County Supervisor Sheila Kuehl's office, Fernando Morales, who's the District Director for the West Metro LA area. And
my former staffer.
And your former staffer,
yeah. My
former neighbor. And Fernando, we've already heard a great synopsis of what's going on. And so maybe you could focus specifically on how the county is addressing concerns and how they might be able to help small businesses in the area as well.
For sure. I was going to put on my public health representative hat for a little bit, but I'll do that after going into resources first. First, I wanted to say belated birthday to you, Chuck. I miss seeing you around the neighborhood as much. And thank you to everybody, including the Chamber, Meg, everybody, Chris, everybody associated with the Chamber, and everybody here for making sure to continue this engagement. So far, the response has been remarkable and heartening from the business community, neighborhood groups, individual constituents. thank you to everyone that's engaged in making sure that we provide resources to our neighbors that are struggling. Many of you that are doing this while you yourself are experiencing loss or hardship. So I wanted to go into some of the resources, first of all, at large that are at the county that you can help, whether it is how to report a health order violation through the Department of Public Health. In the city of Los Angeles, there's also code enforcement, and I'm sure that Rob can touch on this a little bit more. I will be sending the number in a follow-up email along with some resources for the customer call center, the email and the online complaint form. This is for if you encounter somebody that is not following the guidelines established by the health order. Additionally, the county is working to make sure that there are donation sites across the county where people can have easier drop-off of supplies. I know that this has been an issue that has come up in the past. Specifically for the business community, I know that there has been a pretty strong response in people that are interested in being part of the program that Governor Newsom proposed about the restaurant delivered meals. And right now, while the program was announced, the county is working on implementation of this program and making sure that there are guidelines and that there is an avenue for businesses to apply. This is for our restaurants. However, our office is facilitating a list to make sure that any restaurants that are interested are able to get that information right away as soon as it's available. I'm also sending the email, which is a member of our staff at the West Metro office, who will be taking in the name of business, address, link to website, the capacity of the kitchen, name of contact, title, phone, and email, and we will make sure that that information gets to you as soon as possible. The Board of Supervisors also established the COVID-19 Relief Fund for businesses. It was set up through for the Los Angeles Community Development Authority to make grants available. However, it is a little bit tricky because some of the funding that comes in for that is specific to cities that are participating in the Community Development Block Grant. So this includes West Hollywood, but it does not include the city of Los Angeles. Luckily, the Department of Consumer and Business Affairs has established a help center, and I'll go a little bit more into that to make sure that any questions, whether it's PPP or questions about employees that the business has, or making sure that you take different precautions to make sure that your business stays safe during this crisis, they are able to answer those questions, and I'll include those resources. The best website that has the overview and the list of resources that are provided by DCBA is the Main County website under Consumer Businesses, and I will send that as well. It has information about business concierge services, rapid response layoff aversion resources through our AJCCs and unemployment insurance work sharing program and payroll assistance, which was mentioned by Senator Allen, and an extension from the state, and a full resource guide along with Cal OSHA, CDC guidance, and more. As I mentioned before, the Business and Worker Disaster Help Center is something that the Board of Supervisors brought online to make sure that there is somebody on the phone. It's not just an email or sending something through the website, that there's somebody that is able to pick up the phone and help your business with any questions. And this can be a question at the city, county, state, or federal level. We're hoping that this can be kind of a one-stop shop to make sure that all resources and all questions can be answered there. Right now, they are working to expand hours. As you know, Los Angeles County has been working to make sure that, and the supervisor to make sure that disaster service workers are going to the areas that are most needed. And one of these areas, while we have public social services, and obviously you've heard about folks filing for unemployment or getting enrolled in Medi-Cal, there has been an incredible surge in the number of people that are coming into public social systems. However, just as high of a priority it is to make sure that our businesses are able to receive that help as well. So they're able to do one-on-one counseling, and they're open from Monday to Friday from 8 a.m. to 4:30 p.m. Again, working to increase that capacity to make sure that at some point there is potentially even a 24-hour model that is available. Regarding property taxes, and I know we've received a lot of questions about this, The county is waiving the late fees for those affected by COVID-19, and this includes any landlords that are facing hardship. As well, our district office is always available to best connect to resources and answer questions via telephone. I'll make sure to follow up with that telephone. I wanted to give a shout out to our field deputy that covers Miracle Mile, who has taken over the area, Erin Seinfeld. I believe that she is here as well, and she can be a direct resource as well. If it's okay with everybody, I was gonna put on my kind of public health representative hat for a little bit and just go over some developments and where we're currently at. And this information is as of yesterday. There were an additional 56 deaths, including 41 of people over the age of 65 and 35 with underlying health conditions. Roughly 92% of people that have passed with COVID-19 have had an underlying health condition. The Department of Public Health has been working to study linkages and gaps when it comes to services and people that are receiving care and testing, including a report on racial, ethnic, and socioeconomic, how it affects ultimately COVID mortality and transmission. And we have been seeing that there has been a disproportionate impact to communities of color and folks that are lower income. What we're seeing is that a lot of our communities of color or lower socioeconomic status, many of them are in the essential fields. So we are seeing that as you have more of an engagement one-to-one with other people, you see higher transmission rates. As of yesterday, we had a pretty high new caseload of 1,541 new cases. The total for the county is now 22,485 total cases. And something that there's now an additional focus on are our institutional settings. So we're talking about congregate housing sites, we're talking about assisted living, we're talking about skilled nursing facilities. So right now, LA County is working with the state and CDC to increase infection control at these sites, testing and institutional capacity setting, especially for skilled nursing facilities. We have seen 47% of all deaths come from congregate facilities, these institutional settings. So it's incredibly important. I know that, I don't know if part of the Miracle Mile Chamber, there are some organizations that are in the membership that are operate congregate sites. But if they would like some additional connection, I know that public health nurses are in direct contact to make sure that isolation, quarantine areas and every protocol that should be there is currently in place, and working to increase that capacity and training for testing. And I wanted to give a shout out to the city of LA for also helping to lead in this capacity by making sure that LA City Fire is able to do some training. And I know Rob can touch on that a little bit more. So far, the rate of hospitalization and the rate of positive tests have stayed steady. The rate of hospitalization for people that have tested positive is roughly 22 through 25%, and roughly 14% of all tests come back positive. As of now, physical distancing and masking is going to remain in place for many months to come, as Senator Allen mentioned. The transmission has slowed significantly. I think at the beginning of the infection, we were seeing an R0, or the transmission rate, closer to 3. That means that as you have somebody that tests positive throughout the lifetime of the time when they're infectious, they would on average be able to infect about 3 other people, leading to kind of exponential increases. Obviously, physical distancing has worked, and that number has decreased. I don't know what the current number is, but I know that as of 2 weeks, we were looking closer to 1.2. Right now, based on the levels that we have and what we've been seeing in terms of new cases, the hospital system, when it comes to hospital beds and ICUs and respirators over the next 4 weeks, will be enough to meet the demand. And this is in large part to the efforts that our health facilities have put into place, our hospitals, including Cedars-Sinai, that currently has a testing site with some county support, and they have increased their bed capacity by setting up the outside kind of tent triage system that they have. as of now, based on current projections from the county, if we were to relax physical distancing by August 1st, we would be seeing 99% of people within the county infected with COVID-19. Obviously, that rate is significantly lower. I think we're seeing on some of the antibody testing that is being done through a study in partnership with UCLA and USC, that the antibody rates are much lower than that. Let's see. And I think that concludes the kind of public health hat information section. I'd love to take any questions. And also, I just wanted to encourage everybody on behalf of Supervisor Kuehl. I think as much as we need to have conversations about health, physical distancing, how to be good neighbors, we also need to make sure that everybody else also hears the stories of hope and everything that you're doing. So if you have a story of something that you are doing, or you know that somebody is doing, to really reach your neighbors that are experiencing the hardest losses, please let me know. I want to make sure that people know how to plug in and get connected and get involved. So again, thank you to everybody on behalf of Supervisor Kuehl, and it feels good to be back in the Miracle Mile. I think you mentioned it, Senator Allen, about haircuts. I started a haircut, and as you can see, at the end of it, I forgot the clip was off and went a little too short, so in a new style.
That's amazing, man. Seriously.
We do have a question from Stephen Kramer. That was great, Fernando.
Thank you.
And so if you have a question for Fernando and at the county level, what can be done, please raise your hand or type in the chat. You can speak.
Fernando, I had a question to Steve Kramer. I had a question about testing.
Yes.
I understood from stuff I've heard on the news that the city of Los Angeles and the county are both going to begin. I'm sorry for the background. Fuck, I'm going to walk somewhere. There's been conversation about testing for the city and the county. Can you help us with any more information about that?
For sure, and I think Rob can mention a little bit more about the mayor's announcement specifically. I know that the chair of the board and Supervisor Kuehl have been in contact with the mayor since there is the website through which people access tests is operated by the city, but it does provide coverage for testing at city and county facilities. And there are some differences, I think, ultimately in who is able to currently be prioritized. LA County does provide a lot of our testing through EMS and different needs that they have, whether it's PPE to our hospitals. So I think that it's a level of where that testing has been prioritized. And at the county level, right now the priority is to make sure that while we want to make sure to move on to asymptomatic people that are not essential workers or working within a congregate housing site, I think the priority based on the current testing capacity that the county has will be focused specifically on those sites, especially as I mentioned that the number of cases has been increasing there and the number of deaths associated with COVID-19 has been overrepresented in these facilities. So while right now, if you go through the city, if you are asymptomatic, you're able
I think we're losing Fernando.
Fernando just froze for a second. Fernando, can you say it one more time? You froze just a little bit.
Oh, yeah. Oh, sorry.
Thank you.
I know that specifically if you apply through to go to a county site through the website, you still need to have a doctor recommend that you do that testing and be symptomatic at this time outside of people that are in essential fields or in congregate facilities. The distinctions between kind of city testing and county testing is being worked out to make sure that it is reflected on the website. But obviously, as you know, as the governor mentioned and Senator Allen mentioned, I think one of the things that we're going to need to be able to move forward to whatever the new normal is widespread testing. So it is an utmost priority at every level to make sure that there is testing so that we can expand it at large before moving forward.
Okay, thank you.
Steve Rosenthal.
Hi. Hello, everybody. And Fernando, it's specifically for a county question. Apparently, Riverside and Los Angeles County have similar rules, but Orange County doesn't. So what's happening is I'm finding that people who live with me, work in Orange County, are under different rules, don't have to wear masks at work, but my roommate does because he's coming home. I'm in the risk groups. So I'm kind of concerned that we don't have at least surrounding county mutual agreement on masks and social distancing.
Fernando?
I can check that one off from the list. Okay, forgot to unmute once. So I mean, I know that when we're talking about partnerships among different counties, particularly in northern parts of the state, there has been an alliance of different health officers. This is something that I'm happy to bring up to the supervisor so that it can be shared with the other supervisors. But at this time, I don't know that there is kind of that lockstep alliance as you see in the Bay Area with the different health officers. For example, in the Bay Area, a lot of the health officers have already announced together, kind of in lockstep, to say that that their safer at home ordinances would be extended until the end of May. I think working to have that kind of communication and joint communication is extremely helpful to send a cohesive message and make sure that people do stick to the order. But as of now, I know that it's a work in progress.
All right.
Thank you.
And in order to be time conscious here, first of all, thank you, Fernando, for being here with us and for sharing what's going on countywide. And Senator Allen, it's such an honor to have both of you here. But not to be disrespectful to the two of you, but perhaps the man of the hour right now may be Rob Fisher, who is representing Councilmember David Rue's office for the City Council, and with the announcement of the universal testing that the mayor made yesterday. Please welcome Rob Fisher, Field Deputy for Community Planning with Councilmember David Rue's office.
Thank you, Chuck, and it's great to see everyone here. To at least see video of folks. I, along with everyone, were looking forward to another State of the Mile El Rey luncheon, and this is hardly a substitute. But again, it's really nice to see everyone here, and great to see the faces of our partnership here. I think we're very fortunate to be situated in Los Angeles, in the city, in the county, the state of California. We have wonderful partners who are, for the most part, really working in lockstep, coordinating, communicating very well, I think, about how we can best tackle the pandemic, whether it's first and foremost on the public health side of safety and testing, but also on the resources side, on the financial resources. Obviously, this is hitting every aspect of our lives in very significant ways. And, we can't have enough stockpiles, I think, financially to really be able to completely weather the storm. But we are working through these things. And I think, we've been able to uncover lots of resources here and kind of redirect resources that we have at every different level to be more responsive. And so I do want to get into a couple different aspects. I will first talk about testing. We were very pleased by the mayor's announcement last night. Councilmember Rue from the very beginning has made it a top priority to get more testing available in the city. Initially, he worked out an agreement with a Korean company to purchase 20,000 tests for immediate availability in the city. That increased to 100,000 a week. And that was just a drop in the bucket of what we really need. We need massive wide-scale testing. So with the mayor's announcement, this is the case that anyone who lives or works in the city of Los Angeles and with partnership with the county will be able to sign up for testing, free testing, at any of the city facilities. And you can go on the city website and register for that. I do know at the moment that there is still a priority being given to folks experiencing symptoms and essential workers If you do try to sign up and you are not experiencing symptoms or not an essential worker, you may get a notice that the testing is full at the moment. We expect that to be corrected fairly soon, but again, this announcement was just made last night, and that was a shift from the previous testing agreement that was just going to be essential workers and folks experiencing symptoms. So, so again, please bear with us on this in terms of availability on those testing sites, but that should be happening very soon, and you can always follow up with me directly on that. I also want to talk about, I was on a call last night with Wilshire LAPD Captain Paulson. She was giving updates about that, and Wilshire is the main division that covers Miracle Mile, so I'll just focus on that, although I've been dealing with a couple other divisions as well. PD is fully staffed and does have the available resources to be responding to a whole host of issues that are associated with the pandemic and with public safety, with enforcing social distancing guidelines, but also to keep crime down. Overall, crime rates actually have been down by and large. There are a couple of areas in terms of auto thefts, opportunity crimes, maybe where things have picked up some, but by and large they have been down, and I think that's been one of the surprising kind of, or not surprising, but positive outcomes of the lockdown is that that everyone is abiding by it, and criminals aren't really looking to go into homes that have people inside them, or really to leave their own homes to commit some of these crimes. And with businesses closed, also, it's less opportunities there. I know that there have been, been more vigilant patrols in Miracle Mile and throughout Wilshire Division to ensure that people are not breaking into or vandalizing our businesses. And if there are any instances of that and people aren't getting responsiveness on that, please do let me know. I also want to say that I understand that LAPD is taking online submissions of reports of a wider variety now, and I encourage folks to look into that. It is very important that we have reporting of any of these crimes when they take place, so that PD can be responsive to the statistics and we can be aware of where we need to be focusing our resources. So, so I definitely want to encourage people to look into that. Let's see. I want to talk briefly about some of the efforts that Councilmember Rue has done in terms of the business community. One of the initial things, we have a discretionary fund that is quite large, and that had been distributed by the discretionary funds task force, made up of constituents of Council District 4. It's been very effective at distributing that money with a good oversight. A shift that happened during the pandemic has been that we've been able to allocate a lot of this money toward loan assistance and towards essential services. And one of those things was we gave $1 million to Jewish Free Loans, which is administered through the Jewish Federation, and that is something that anyone can sign up for. They have a significant sum of money. And I want to encourage, that as one of many resources where small businesses can look into to get those free loans out of. On our website, which is davidrue@lacity.org, there is a whole list of resources for business loans and these sorts of things. So that's just one of those. The City Council also passed a eviction moratorium, which applies to retail, to commercial businesses, as well as residential tenants. So that is a moratorium during the emergency period and for 3 months after. And that protects folks from being charged late fees or interest fees on that rent. Now, obviously, that money is still going to be owed, and there are issues with government at any level being able to intervene in a private contract between two parties. So ultimately, that's what a lease is, and for the government to say that that money should be forgiven or other shifts to that agreement can be challenging. But at the moment, this is what exists, and there may be changes to that. Councilmember Rue has also been supportive of a responsible banking ordinance, which encourages the banks who do business with the city to disclose their plans to provide mortgage and rent relief. You know, that's something that we want to keep a close eye on. If we as a city are doing business with these folks, we would like to prioritize those that are being responsive to our constituents and the needs of the city. So that's something that's moving forward, that, and ultimately our ability to really crack down will depend some on our partnership with our leaders at the state level and at the federal level as well. I also want to briefly touch on some movement with our artist development fees that are collected by developers in the community that generally go towards putting on art and music events throughout the city. This is something that Councilmember Rue, being the chair of the Arts Committee, is particularly attentive to, and has moved to shift these funds to be made available as a grant program for local artists. You know, this is something that's moving through the council, and I think will move through quite quickly. It was covered in the LA Times today, but something we're pleased about. We need to be supportive of all aspects of our community, and particularly our artists, which bring so much joy and vibrance, particularly in the Miracle Mile area. We want to be supportive of that, and we don't want this money just sitting there and not being allocated to its most needed areas. And then lastly, I just want to talk about volunteer and outreach work that we've been doing. Been very happy to be in Council District 4, where we've been using a lot of different technology and volunteer building to reach out to folks. We've been doing direct texting with seniors and with renters throughout the district. About 20,000 folks have been reached out to. It allows us to go back and forth with them about any needs, and send them links, and connect them up with food delivery. We've also partnered with a company out of San Francisco called Mon Ami. This is working also with the city of San Francisco and with Mayor London Breed, and now Councilmember Rue has signed up with them. And that links seniors with volunteers who have a background check and maybe are matched by interest as well. And they can pick up groceries and prescription drugs and any other essentials and deliver them to them. And that's something you can sign up for on our website. And lastly, through that, we are doing volunteer calls on a nightly basis to seniors in the district to figure out their needs and to find ways to link them up with whatever services they might need. And if anyone is interested in signing up for that, I'll encourage, and I'll send these links around too. If you go to our website that I gave, davidrue.lacity.org/volunteer, you can link to all of these opportunities. And I know, you know, everyone is trying to cope with the time allocation of working from home and wanting to feel productive and useful, and volunteering and talking to folks is a great way to do that, and can be really rewarding. So I definitely want to encourage this group, who I know has always been so great about stepping up and engaging with the community. So, and with that, I'll open it up for any questions or comments. Happy to take them.
I have a question for you, Rob.
Yes.
You notice you mentioned the art implementation. Is that going to be going out just for CD4, or would that be going out to other?
No, that would be citywide.
Citywide, great.
As chair of the Arts Committee, Councilmember Rue has been moving this forward. Look for movement in the coming weeks, the council on a whole on this, but so far we've seen support from the other council members for this.
Great, thank you.
I mean, yeah, so then maybe we could bring Michelle in. And
Anybody else with a question? You can raise your hand physically or use the hand raising.
See that Joyce Kleifeld has a question.
Hey, hold on one second. Joyce, you can unmute yourself.
Thank you.
Thanks, Chris. And thank you, Rob. It's good to see you. And thanks for a great presentation. As far as the testing goes, is the city and the mayor encouraging people to sign up for testing, whether they're symptomatic or not, or is that just what's your advice?
Yeah, no, certainly we are. And I think that is one of the crucial steps that we're going to need to be able to move forward with with rolling back the safer at home measures. We do want to get everyone tested, and we want to have this information so we can be more responsive to hotspots and to populations that are affected. Like I said, I think it may take a couple of days or a little bit of time for this to be widely available when folks try to sign up on there to get testing dates open. But that's absolutely the basis for that announcement. And you know, we're happy to be out in front of other cities to be able to offer this. And you know, I think that it's really essential that everyone engage in this and get tested.
Michael Rosenzweig has a question. Michael, I will unmute you.
Hi. So first off, I was part of the county pool for antibodies a few weeks ago, and unfortunately it turned up negative. Does the county plan to do that again? Because a lot of my friends, when they heard about it, wanted to do it. And then second question is, you know, unlike other major cities like Philly and New York, where the city and the county are one and the same, here it's not. And obviously, Los Angeles is the biggest city within the county, and they seem to be cooperating now, but you've got places that are unincorporated, which people may think they live in the city of Los Angeles. So how are the city and the county going to work together to make sure that those sections are, you know, they think they may follow the county, but it's really the city, or vice versa?
Hey, Rob, do you mind?
Yeah, no, why don't you speak to the antibody side of it, and also maybe to partnership? Sure.
Right. So the antibody testing is ongoing. I know that while people are able to sign up, it is a random, you know, it is a random sample and it is a study. So ultimately, it may not be something where somebody says, "Hey, I really want to be part of it," and that's the person picked. Just to make sure that you know, that the collection is representative of the entire county. But it is ongoing, and it will continue for the foreseeable future. The samples, I believe, are over 1,000, under 1,500 people, and it will continue for the foreseeable future. In regards to kind of communicating on testing from county and city, I think that it's really helpful that there's one site. You know, there's one site for everybody to access those resources, and based on qualifications there. I know that due to recent announcements, I think there's some additional communication as to how to make sure to differentiate. But I think everything that I've seen so far from city and county regarding resources is that there isn't a wrong door. We're hoping that this will be a system where, regardless where you go in, if it is that you contact the emergency disaster center at the county, we can help connect to the city, and on testing, it is through that portal for everybody. So I would hope that would solve some of the issues that come up from somebody being an unincorporated or a smaller city on that end. And Rob, I defer to you as well on the city side.
Sure. Yeah. So, you know, that this testing is available for residents and workers in the city. I don't believe there is a strong filtering process that would keep folks out from wanting to get tested in there. And so, yeah, I want to encourage people to pass us along to anyone, share it on any of the networks that you're in, and you know, I'm sure we'll be doing a lot to promote this and get this out there.
Excellent. Wow, that was a jam-packed session. Can you believe we've been on the phone for an hour already, and we still have a few more things to do? Are there any final questions people are burning to ask either Senator Allen or representatives from Kuehl's or Rue's office?
Yes, Jill, I'll unmute you.
Can you hear me?
Yep, go ahead.
Thanks. I think this is probably a question for Senator Allen. So I work at Los Angeles Museum of the Holocaust, and I'm wondering, given the different phases of reopening that you ran through, where do you see museums landing? More in the retail spaces where distancing can be maintained, or more toward the large sports venues?
Yeah. Well, I think if it's the old way of doing museums, it's in the large sports venues model. But if we can all work together to come up with a new model for accessing museums that don't involve packing people into a small space, I think we can shove it into the retail category. And so it's all going to be about agreeing to certain terms. There is a lot of national conversation happening about this. I've literally just sent a letter. I'm coordinating with Cal Nonprofits, a letter to the federal government to get additional support for museums given the crisis. I think they've been kind of lost in the shuffle a little bit, and we can get you a copy of that. My staff's on the call and get you a copy of that letter. But I think, and actually, I'd be really happy to work with you on this if we can figure out a way to proactively come up with a social distancing plan for our local museums that we can submit to the folks at the state and the county, get some feedback, hone, and really do whatever we can to try to get you guys into the earlier phase. I think that would be a really worthwhile exercise.
Thank you.
I was going to chime in as well, just to say that I'm happy facilitating connection with Department of Public Health. They've been working to create guidelines at every level, and I think that in communication with the city and the state, some of the changes and added guidelines have been, pretty nimble and have come online pretty quick, such as the example of our farmers markets. I think officially there were some pretty large concerns, and you saw that obviously whenever you provide an avenue back to a certain resource that can not only be necessary in terms of something essential, but beyond that, something recreational that people are really missing, people kind of flood in. But based on those guidelines, we're now seeing that people are remaining safe within those environments.
All right. Thank you so much, Senator Allen and Fernando and Rob, for joining us today. It's been an honor to have you here, and it's been so good to be able to ask you the questions that are on people's minds. And just thank you, everyone. Just quick, yay! Thank you for being here. That silent clap. All right. Oh, well, that's another thing, right? Okay. So I'd like to move on to the next portion of our session today, and it's a happy thing. It's new members. Even in the midst of the current crisis, Meg McComb, who's executive director, of course, of the Greater Miracle Mile Chamber of Commerce, is working hard to expand membership, and we're delighted to introduce that we have not one, but two new members to our ranks. And first, I'd like us to help welcome Elka Susana with Simpler Horizons Insurance Solutions. Chris, if you could unmute Elka for us real quickly.
Unmuted, and Meg, you're unmuted as well.
And Elka, would you give us your 1-minute elevator speech? Tell us a little bit about Simpler Horizons Insurance Solutions.
Thank you guys, first of all, so much for putting this together. It has been so educational, and it's great to see all the faces. Although I'm looking forward to meeting everyone in person eventually. But this is really just phenomenal. So thank you, Meg and Chris and Chuck and whoever was involved. I'm still getting to know everybody. So Simpler Horizons is been around since 2012. I actually am born and raised right here in the Fairfax district. I live here in Miracle Mile North. I love it. I have 4 kids. Raising them here has been amazing. So I love this neighborhood, and it's really the only neighborhood I know. So it's fantastic. Simpler Horizons is a very niche-focused insurance agency. Our niche is Medicare. So we deal with the 65-plus community a lot. We host events, which we've had to now shift to Zoom meetings or one-on-one personal appointments. We educate them on how to get started with Medicare, how to select a secondary plan, and also we assist them if they need resources on how to apply for low-income subsidy. or to apply for extra help with Medi-Cal. We're a resource, and we also assist them with the secondary options to Medicare, such as Medicare supplement, a drug plan, or an HMO. And we represent all the plans in the county that are available outside of Kaiser, only because Kaiser doesn't work with brokers. But we will educate them on that if that's an option for them. The best part is we don't ever charge for our services. So whether it's educating someone on how to get started, helping them apply for low-income subsidies, or teaching them how to work better with the plan that they already have, we do that at no cost, and we have brokers that speak a multitude of languages. So whether it's Korean, Vietnamese, Tagalog, Spanish, we're there to support the community, and it is the most fulfilling work that I've ever been involved with. So I'm excited.
It sounds fulfilling.
It is.
Marvelous. Welcome.
Thank you
Welcome,
so much. Thank you, guys. Thank you.
Absolutely. And next, I'm pleased to welcome Zak Sokoloff with Hackman Capital. And is Zak on the phone call?
I am looking currently.
Zak, if you are, raise your hand on the screen. I'm not seeing him right now. He may have to leave. Meg,
I had to leave a little early there.
Meg, can you just say quickly what Hackman Capital does or what you know?
Oh dear, now I'm really in trouble. I believe they are involved with CBS. They are the new owners of CBS.
Oh, yeah.
So obviously we love having them part of the Miracle Mile. Of course, they are in the Miracle Mile, and a rather large portion of it. So we're looking forward to working with them and having them be involved, as all of you are. So thank you all for joining us today. It's a real treat, and we're looking forward, of course, to the time when we all can get together safely and happily.
Excellent. Thank you, Meg. Well, here we are. We're in it. This is the pandemic. This is what people have said could happen. And obviously, it's affecting our business community like nothing else. What I love about being a part of the chamber, of course, is being surrounded by you all. And whether it's physically or virtually, but just being around these extraordinary business people and witnessing the exceptional spirit and vitality of everybody in the midst of this crisis. And so we thought it'd be nice for this brief moment of time, and kind of getting to what Senator Allen was talking about a little bit earlier, just talk about for the next few minutes what we here at the chamber are doing, what our members are doing right now to meet the challenges head on. And so here's the question for you. What are you and your business doing to meet the challenge of the crisis? We want some of those good, feel-good stories. What are you doing to meet it? How are you surviving with your business or keeping things going? And or an alternative question to that is, what are you doing right now to positively impact the community, even if if it's not necessarily helping your business, but helping the community in some way, shape, or form? And so just kind of think about that. Raise your hand click the little raise your hand thing, or type something into chat really quickly. But we'd love to hear from you for just a moment. What's some of the good stuff that's going out? And I'm going to share one first off that I heard about. And they're not on the call. They were supposed to be, but they're at the vet with a sick dog right now. Good Gracious Catering is partnering with Children's Hospital, and they are providing. This number was extraordinary to me, and I'm still not entirely sure I heard it correctly. 9,000 meals for Children's Hospital that Good Gracious Catering is doing right now. And they're doing it at a fraction of the cost. They're not making any money off of it, but they are keeping their people going and their employees going, and they're doing a vital service for Children's Hospital. That's the good stuff that's going on with our members. What all are you hearing? What all are you doing?
Great, I've got a couple. So I'm just going to read one off. The Larchmont Buzz is offering a free website ads to local businesses during the shutdown period. So yay for Larchmont Buzz.
Great.
The Museum of Holocaust is offering free virtual curricula for teachers in middle and high school. The chamber itself, I'll just let you guys know, if you have any offers that you're setting up for the community, just send them to myself. We were posting on social media pages, and I'm also e-blasting them. And I've got a couple more people, so I'm going to just go down with these hand raises. I'm going to start with Meg. Meg, you can unmute yourself. I've unmuted.
I think I can do that.
You unmuted? Nope, you just muted yourself. I got you again. There you go. I'll do it. Hold on. I'm going to unmute you. There you go. Nope. Meg, let me do it. I'll just unmute you. There you go. Okay.
Okay. Okay. Some of us are cleaning out our closets. I now have a walk-in closet that I didn't have before, but in the back of it was a roll of 10 yards of fabric that is never going to be turned into what I originally planned. And Chris took that fabric, and I believe his fiancée, Samantha, is turning it now into masks. And I'm just, what a thrill.
Thank you, Meg. I'm going to go to Stephen Rosenthal next. Okay. Steve, can you unmute yourself, please? Okay, I'll do it. There we go. Try to unmute you, Steve. Can you unmute yourself, Stephen Rosenthal?
Yeah, I did. Thank you. Hi. First of all, Olympia obviously is right in the middle of all this. We've had a steady increase of COVID-19 patients since the beginning. It's increased again, but we have had a lot of the community members raise funds to pay restaurants to deliver food. The frontline people are working more than 12-hour shifts. And as you may know, that even doctors, patients, and any visitors, and the only visitors are allowed if it's a possible death. They all have their temperatures taken, no matter what symptoms are asymptomatic, every doctor, every patient, and every employee. They've been working before they go into the hospital.
Thank you, Steve.
Excellent.
A couple more.
Excellent. Thank you, Steve.
That's terrific. We do have Gift Global Initiative.
Yeah, that's what I was getting to. Yeah, Gift Global, Keith Kirkwood personally delivered pizzas from Rocco, as well as he's working on sanitizers. We have gotten gifts of masks, gotten gifts of coveralls from Big Sunday, also did pizza. We have Sweet Greens, Far Best. There's many restaurants that have all put together programs. And folks from Carthay Square and Carthay Circle have raised money and provided 150 meals for the hospital front line. So we're just very grateful for our chamber members and for the community, and thank you all.
You guys, I'm going to mute you now. I'm just going to move on to our next member. I'm just going to chime in. Yes, Gift Global Initiative is delivering meals. They're raising $500, and then they're going to local restaurants. So they're actually paying for those meals and then having them delivered to Olympia, Cedars-Sinai. I'll be sending out that email one more time. I'm just going to read a couple more here. From Karen Sorrow, our family has produced over 40 reusable cotton masks for Valley Community Healthcare and over 40 masks for families across the nation. Yeah, and I'll just say a plug for my fiance, Samantha Karen, and myself. I'm like 1 to her 5 masks. We've been churning these masks out, and we donated some to Lee Initiative, which is making it much more easier for restaurant workers right now who have reduced hours or no hours at all. Off of Squirrel, they're providing meals every day for these restaurant workers who are out of work. I'm going to go to, I believe it's, yes, Joyce. Unmute yourself.
Thanks, Chris. I just have to kind of get a shout out to the Wilshire Rotary Club, which I am a member of, and Pam, I think Pam is on this call. She is a member of. Anyway, the Wilshire Rotary Club is helping by doing a food drive, canned food, packaged food drive, to help stock up many of the food pantries in LA because the food pantries are running very, very short. So what I'd like to do through you, Chris, is send out an announcement as to the kinds of things we're collecting. And if you put them out on your front lawn, we'll have people come by and pick them up and deliver them to the food pantries.
Absolutely. That's great, Joyce. Stephen Kramer.
I just wanted to thank Chuck, Meg, and Chris for putting this together. It's not as easy as it looks. I know it's not as hard as it looks, but that's just me. But they spent a lot of time putting this together, and I think it worked out beautifully. And I look forward to our next meeting.
Right, perfect. And I'll be sending out that information. I also, wait, let me just read. I also want to just acknowledge Red Real Estate, who's been helping out people in the Miracle Mile community with drop-offs and pickups for those who can't leave their home or who do not want to leave their home. So Chuck, you just want to say something briefly about that? That would be great.
Well, we just worked with our neighbors to get out about 2,500 flyers, and we were trying to find people who were in high-risk categories who didn't already have neighbors or friends or family available to help go to the grocery store or the pharmacy for them. And so we put together about 25 volunteers in the neighborhoods, and we served about 20 people since the beginning of this. So on an ongoing basis, doing grocery shopping and other errands for them so they don't have to leave. But it wasn't really us. It was the neighbors and the neighborhood come together. We just acted as a catalyst for that.
Terrific.
So, yeah, it feels good to do good, right?
Yeah, it's terrific. A couple more to read. LACMA is providing free content from videos about artists to 3 videos with new activities for kids posted every Friday to webinars with artists and film screenings on YouTube. LACMA at home, and we are donating our masks and all our other protective gear used by our exhibition installation teams for medical use. The Academy Museum has donated all of our unused civic suits, I hope I'm pronouncing that correctly, shoe covers and gloves to Cedars-Sinai, also providing much watch lists via our weekly e-blasts. And that's also in the chat. I'm going to go down to another message coming in. And Michael has he wants to acknowledge some businesses. Michael, unmute yourself.
Yes, hi. So I'm the property manager for the Midtown Crossing Shopping Center, and the majority of our tenants are still open. Lowe's, obviously, Smart & Final, PetSmart, the banks. Our restaurants are open, with the exception of Pizza Rev, and they could really use your business, especially Jersey Mike's and Chipotle. Starbucks is back open, but you have to do an online order only. They will not accept counter orders, so that's just something to keep in mind. Even the Joint, Chiropractic, and Bright Now Dental are open. If you go to Chase and Wells Fargo, try not to go on the 15th or the 30th. They're 2 very cash-heavy paycheck-to-paycheck branches, and there have been lines, sometimes 20 people deep, outside of Wells Fargo. So it's just something to keep in mind if you're down there. We have plenty of parking. We have 3 levels of parking. So you don't have to worry. If the 3rd level is full, you can go down to the 2nd level. And then also, property manager for District La Brea, which is the 100 South Block, odd side, most of it. Sugarfish is open for takeout only. And then Garrett Light is open by appointment, and several other tenants you can, if you need clothing, you can buy it online, but we're hoping to have everybody back open as soon as possible.
Thank you, Michael.
And in the spirit of time, because we've run a little bit long today, we also want to ask, what can we're a community. We're here to help and support each other. What can we do to support you and your business right now? What do you need us right here on this call to do for you right now?
Raise your hands and I'll get to you. Or type it into the chat.
Pam Rudy's raising her hand.
Pam Rudy, you can unmute yourself. Pam, can you unmute yourself?
Pam, you have to physically unmute yourself.
There you go. I got you.
What do you do?
I unmuted you. Now you can be heard.
Oh, good. Okay. Thank you. It's so nice to see everyone's face. I've missed seeing you all. What I wanted to do was to reinforce what Joyce said. Yes, please bring your items, your canned goods to the Christmas tree lot on Larchmont Boulevard, which is at 564 North Larchmont Boulevard. So any pasta, rice, grains, soups, anything that you could possibly do without, we would love to distribute to the food banks. The other thing I wanted to say is please take a look, especially at the centerfold of the section 1 of today's Larchmont Chronicle. It has some great areas and places for you to find services and read the paper. Lots of information to help out during this time. That's all.
Thank you.
That's excellent. What else do you have for us, Chris?
Well, we've got a raffle, Chuck.
All right.
I feel like I'm Ed McMahon. All right.
But I do want to remind you, we are here for you. So if you need something, reach out. Reach out. We want to do what we can to help our members and, of course, the people that you love as well. All right. So we have a raffle. And what we have in that raffle today includes, we have 2 healthcare directives from Steve Kramer. We have a bottle of red wine from Red Real Estate Group. We have a wooden jigsaw puzzle donated by Nutmeg Unlimited. It is, by the way, she's given me one of them before, and they are maddeningly hard, and you're going to love every moment of it. And we have a 1-hour Zoom fitness consultation with Bootcamp LA with Marcela Flores and Jay Kerwin. So we've got 5 exciting raffles, and everybody who RSVP'd was entered into the raffle, and Chris is going to announce who the winners are right now.
Okay, so just give me the first item, Chuck, because I'm doing 3 things at once right now. If I can just get the first item, we're going to draw.
All right, 1 healthcare direct. Now, I'm assuming, Stephen, that these are 2 separate prizes, or are they 1 prize? Is it 1 prize? It's 1 prize. Okay, 1 prize of 2 healthcare directives from Steve Kramer.
All right, great. Here I go. And the digital bingo is running, and we have Guy Eisner. Is Guy on the call? Guy?
I am here. Thank you.
He's there.
Yeah, you got it. So you got 2 healthcare directives from Steve Kramer.
Wow. Thank you.
Steve, you just want to say something real quick?
No.
Yeah. Not with that feedback. All right, the next one's a bottle of red wine from yours truly at Red Real Estate Group.
Okay, here we go. And it is, it carries over that we do have another new member. It's the new member luck. Elka, you have won a red bottle of wine.
All right, Elka, you and I will talk about how to get that to you.
Great, all right.
And then next one is a wooden jigsaw puzzle from Nutmeg Unlimited.
Terrific, here we go. And, oh, Patricia Gillis.
Patricia.
Is Patricia still on the phone, on the line?
Patricia. I do not see, we might have to draw another.
I think that would be fair.
All right.
All right, we're gonna draw another. Let Patricia know she missed out on that jigsaw puzzle. Cara, is Cara on the line still? Cara Theodore.
Too bad.
You had to take care of the Mansfield. All right, 1 more. Here we go. Patricia got it. It really wants Patricia. Jill Brown.
Yay! Good for you, Jill.
Thank you.
You're
Very
love
excited.
Okay, Jill, we'll be in touch. I'll get it to you.
Thank
You'll
you.
love it.
Thanks, Meg.
You got it.
All right, and finally.
Hey, excuse me, Chuck. Chuck, excuse me, it's Kramer. I just want Guy Eisner to know that those healthcare directives, if he's already got them or his family does, he can transfer them to somebody and just let me know.
Okay.
Thank you.
Thank you.
All right.
Excellent. And finally, a 1-hour Zoom fitness consultation with Boot Camp LA.
Here we go. Rolling the bingo there. Marcella won.
All right.
It continues over. I love it how digitally it just doesn't change this in real life. Here we go. We're going to draw again. Alicia Buss, is she on the line?
Didn't see her.
Nope. All right.
Draw again. RJ, is RJ? No, I don't.
Draw again.
RJ, you're gonna draw again. All right, here we go. Michael Rosenzweig.
He's still on the line.
Yep.
I'm here.
You won, Michael.
Great. Thank you.
So Marcella will be in contact with you, and she'll get you set up.
You can work off all that
Okay.
Chipotle.
Haven't had Chipotle in yeah. Mm-hmm.
You're on the line. Everyone can hear you.
Yeah, I know.
All right. Thank you, everybody, for participating in this, the first virtual Greater Miracle Mile Chamber of Commerce luncheon. It went so well, in large part because of the work that Chris Devlin put into all the technical testing of everything and make sure everything worked long before we got on the line. And Meg, of course, who is incomparable in getting everything organized. And thank you to everyone for being here today. We'll be talking more about the next one. You'll see, just check your emails. And of course, as soon as we can, we're going to get a State of the Mile going.
Yep.
Once we open things up again. Thank you, Senator Allen. Thank you, Fernando. Thank you, Rob, for being here. It was such an honor having you. And we hope this was helpful for you as well.
That's great. I just want to chime in with real quick. We do have some great guests for our next one as well. As these were just terrific. You guys were fantastic. Thank you so much for joining us. We're going to have Assessor Jeffrey Frank, Ron Galperin, and I believe somebody from Bloom's office for our next meeting. So it's going to be terrific. That's going to be in the middle of May. And we are working on Gavin Newsom's office as well. So stay tuned. And just to let you guys know before you leave, I'm going to keep the meeting open just a little bit longer. On the bottom of your chat window, there's a little thing that says File. There's such great information that came in from everybody. You can download that so you can have it, all the links and everything. If you just click on File and download to your computer. And I have recorded this as well, so I'm going to work on getting it out to you. And thank you once again for joining us. All right, you guys have a great day.
Thank you.